Good morning, everybody. My name is John Sabose, and I am here on behalf of Protect Our Care in New Hampshire, where we're talking about something very important, a watershed in American history, a watershed in public health. Today, we're looking at 60 years of Medicaid, the cornerstone of America's healthcare system, providing critical coverage to low-income families, seniors, children, people with disabilities. It was created back in 1965, along with Medicare, the program that has helped millions access essential care from doctors' visits and hospital stays to long-term services, often unavailable through private insurance. And in states with big rural sections here like New Hampshire, Medicaid is not merely a safety net, it is a lifeline that supports community health centers, keeps rural hospitals open, ensures that working families can get the care that they can need close to home. Because Medicaid doesn't just support those who are on Medicaid, it supports the entire system. And that's what we're going to do today. We're going to look back at 60 years of Medicaid in New Hampshire and look forward at the challenges on the road ahead and what those impacts might be. I've got two great guests on with us today. Once again, I'm Ed Shanshala, who is the CEO of Amanusa Community Health Systems. Thank you for joining us again, Ed. And a new guest on this set of podcasts, Arnie Arnesen, who is, of course, the host of The Attitude on WNHN and a syndicated talk show that's heard all throughout America. So it's a privilege to have you both join me today. I'm going to ask a series of questions. Feel free either to jump in. I can start with you, Arnie, because you're new to our show. Looking ahead, what improvements or protections do you believe are most critical to ensure Medicare and Medicaid can continue to serve the granite state for another 60 years? And if you want to start that answer with a little bit of context of where we've been
I think context is absolutely important because we need to understand its success in order to know what we're saving, okay? And so I go back to 1965. And what I think is so interesting is that in 1965, when LBJ decided to create this thing called Medicare and Medicaid, what he realized was that old people basically were not being insured. Okay, and they could not gain access to insurance. So, and he understood, he said, okay, so we want to protect the older Americans. And that was something that was very sensitive, and people were like, oh yeah, I like that idea. So they decided that Medicare would kick in at age 65. Now, you know why that's an interesting number? Because in 1965, the average male lived to 66. The average female lived to about 72. So when they thought, 65, they're only going to live a couple more years, what the heck, we'll cover them, it'll be good. Everybody will love that grandma is covered with Medicare and Medicaid. So let me fast forward, Ed, you're going to love this. So you go to today, and you look at what the average American is now living to. So let me give you the new numbers. Today, males are living to 75 years of age, and females are living to a whopping 81. So what we know about Medicare and Medicaid was that it worked. It worked. It invested in people. It made sure they stayed healthy. And then they followed them through the rest of their end of their lives. Sure, we stopped smoking. Maybe we didn't drink as much. Maybe the EPA actually made sure our air and water was clean. But when you look at the gestalt of all the things we did, providing this idea of this universal health care to anyone who was 65 or the disabled, it actually benefited the elderly, but it benefited the economy, Ed. Because now if you had a healthy older person, you could still go to work and not stay home to take care of your parent. If you knew that your parent would end up going into a nursing home, Medicaid could step in and help pay for the nursing home so you could still work and provide for the economy. So there was it was almost seamless in a lot of ways. We didn't recognize how successful it was until what we saw, especially now with the big, beautiful bill, is that now they're basically pulling the rug out from all of us. And it's not just going to impact people who are on Medicaid. It's not just going to impact maybe even people who are on Medicare. It's going to impact an entire community and country and state. And one of the things that Ed, you don't know this, but I used to be the president of the board of Tri-County CAP, one of the largest poverty agencies in the state, up in Berlin, New Hampshire. And here is my favorite story, because this was before we did the expansion of Medicaid, where we allowed working folks to actually participate in Medicaid. We're one of 41 states that do that, which is phenomenal. But that not only did we do this, but at one point in time, Ed, the mayor of Berlin begged for the two prisons to come to Berlin. And the reason why the mayor wanted those two prisons was he saw that his paper mills were shutting down, that manufacturing was disappearing. But he knew he needed people with benefits to be able to keep his hospitals open so they would be available to people in Berlin and the surrounding area. So most communities don't beg for a prison. He begged for both. Okay. And even though he was a Republican, all right, I would just remind everyone, he was a Republican. But what he realized was that was job stability, it was community stability, and it meant that he could keep his hospitals open. What we are now doing by literally pulling thousands of people off of Medicaid, by possibly even getting rid of Medicaid expansion because the state of New Hampshire has a trigger that says if the feds continue to stop funding it at 90%, they may then back away. Not only will you lose all this access to healthcare for those individuals, but those small rural hospitals, of which half the acute hospitals in New Hampshire are small rural hospitals, will not be able to keep their doors open. And there isn't a third prison the mayor of Berlin can ask for, or there isn't a third facility. And in the end, it isn't going to just impact people who don't have Medicaid. It's going to impact the guy who wants to bring his wife to the hospital because she's going to have a baby and he has a great health insurance plan, but that hospital doesn't exist anymore. So instead of traveling 20 minutes, he has to travel an hour and a half. Everyone is impacted. It's not a Medicaid story. It's our story.
Ed, I know you've got a
Yeah,
something
so
on
I
that.
explained about the Medicare. I grew up in the Alleghenies in northwestern PA in Appalachian Economic Development area. And my Ukrainian grandmother, who had 13 children, lived in 96, and she was on Medicare. I spent 20 years living there. I spent 20 in Rochester, New York, and witnessed the St. Mary's Hospital close. I witnessed the Genesee Hospital close, and they've never come back. And you can still feel the damage this 20 some years later. So in northern New Hampshire, a different set of mountains, Ammonoosuc Community Health Center, a federally qualified health center, the People's Health Center, 26 towns, 30,000 residents. We see 1 in 3. Medicare and Medicaid are very important. 37% of our patients are Medicare, 13% are Medicaid. So half our patient population are Medicare or Medicaid. And to your point, that when we don't invest in those programs for those who are eligible for Medicare or Medicaid, then we have on insurance, commercial insurance premiums will go up, bad debt goes up, and there'll be closures. Preemptively, I've had no choice but to announce the closure of one care facility in Franconia, because when Medicaid expansion goes away, that's a $500,000 adverse impact on the care we give. So we've chosen to disinvest in bricks and mortar so that we can hedge and invest in our staff and our friends and family and neighbors that we care for. So that is very important. And when we think about investing in primary preventive care, for every dollar we invest, we save 13 later. From the economic perspective, Medicaid is the #1 revenue stream into New Hampshire, whether we like it or not, it is. And the economic multiplier on the street for a cup of coffee, a mortgage, or a car payment is 3 to 1. And as you had talked about to my north in Coos County, Androscoggin is the hospital that delivers babies. Since I've been here, Cottage Hospital has ceased, Weeks Hospital has ceased. And if Androscoggin cannot afford to deliver babies, then there is no hospital to deliver a baby in all of Coos County. Roughly, I think around 60,000 people. Berlin is the largest town in the North Country, Littleton being number 2. So it's hard to develop the economy when people come and want to deliver their baby. So you're absolutely right that those who think, I'm young, I'm not on Medicare, or, I'm not on Medicaid, I don't see how this affects me. You have started to connect the dots that it's the entire fabric of our community, Medicare, Medicaid, commercial, that drives the economic feasibility to keep access open from primary, preventive, emergency, acute, delivering babies, skilled nursing homes. County nursing homes are predominantly Medicaid. Almost every county has one. I worry more broadly beyond Amanuensis as a primary preventive to that broader healthcare system and helping people understand how it adversely impacts them and their friends, their family, their neighbors.
And let me just say something, John. I mean, we want to attract young people to New Hampshire, okay? And let's be honest here, Ed, the only affordable place they may be able to live is going to be in the North Country because the average price of a house in New Hampshire is now $540,000. And I don't know about you, but I'm not sure I could have afforded that. So again, if you want to attract a family, families need an OBGYN. Families need a doctor. And even if they come with health insurance, if there isn't a hospital, how can they live there? How can they take care of their family? And remember, you could be healthy, but you could fall down a flight of stairs. Yeah. You could be healthy and you could have a heart attack. You can develop cancer. So all these things are so connected. And I want to remind everyone that by doing Medicaid expansion, we included 60,000 folks in New Hampshire to be covered by Medicaid. They were working. Okay, they are working. So I don't want to hear this work requirement garbage because it's garbage, Ed, because most of these people are in fact working unless they are the elderly, unless they are caring for a baby. But virtually everybody is working. We're just making it more difficult for those that work to stay on it. And here's the thing. You asked the question, John, about what can the state do? So if the feds decide to start getting out of this business, let me remind you of something. We have a trigger in 2018. And right now, in order to encourage states to do the expansion of Medicaid, they paid 90% of the cost of the expansion, and all the state had to do was kick in 10%. And Ed, as you turn out to say, there's such a benefit to doing this financially for the entire state. You know, what's that 10% with the amount of return you're going to get in the economy? But we have a trigger that says if the feds stop doing this, we will back away. Now, here's the problem. New Hampshire is like the fourth richest state in the nation, everyone. You don't believe it, but it's true. You may not see the money, but there are a lot of rich people in the southern tier. Anyway, we're the fourth richest state in the nation. And the way they cut Medicaid checks to a state is based on wealth. So the problem is because we are so rich, we don't get as much money from the federal government because they assume we have the wealth to make the difference up. You asked, what is the role of the state? Well, the role of the state is to actually tap their rich, okay? And that means that they have the capacity to continue to cover these 60,000 working folks. And the investment in them staying on Medicaid isn't just an investment in them. It's an investment in all those communities that are being served by those 60,000 so that the hospitals will stay open for people who are in the tourism business, for people who are in the restaurant business, for people who are in the ski business, because you're not going to want to come skiing, break your leg, and not have a hospital to go to. So this is such a ripple effect that even if the feds back away, one of the best dollars the state of New Hampshire can spend is to continue to ensure that the expansion of Medicaid continues because it has made such a return on investment, both for those hospitals that you were talking about, as well as for the communities that depend on those individuals.
Yeah, when I go down the street, and people talk to me, it's very few degrees of separation. It's a very tight-knit community, whether it's Littleton, Bethlehem. I happen to live in Bethlehem. Those are the two communities I probably know the best. And I talk to shop owners, and I have a sense of they tell me, I don't ask, of where they get their health care and how they fund it. And you're absolutely right that they're on Medicaid sometimes, and they have a handful of people in the shop that work there. It's a coffee shop, it's a restaurant, it's whatever the case may be. And sometimes they're younger, they have families, and they're driving the economy, and they need to stay healthy, and their employees need to stay healthy, and their economic situation qualifies them for Medicaid, and they're making significant contributions. They're on town boards, they're on school boards, they volunteer, so making significant contributions to society in and above what we invest. I like to see it as a co-investment in their health and wellness. In the same with, we have a significant Medicare population. That New Hampshire is the second oldest, fastest aging state, and the North Country is the oldest, fastest aging piece of that state. And those people too, when I look at, they're pretty healthy. Um, I look at their volunteerism, they're out on mountain bikes, and they're Medicareable. So they are taking care of their own health or contributing to the community in many ways.
And it sounds like, you know, this program in the last 60 years has been very successful. Obviously, it hasn't helped to tame the runaway costs that we're facing, but it has helped to channel money into preventive care and to helping maintain a relatively good network of care across New Hampshire. I guess my question is, and I'll ask Rachel to come in with media questions. Where do we go from here? 60 years of good work is being undone before our eyes, and this is not a political statement. This is what's coming out of this big budget. I'm not going to use the word beautiful. Um, what's next for community care in New Hampshire? And I don't just mean the North Country. And we've seen hospital consolidation on the seacoast. We're seeing it in Manchester, and we see, hospitals with question marks in the future in places like Plymouth and in Keene. Where do we go from here? And either of you would like to answer.
I think a couple of things have to happen. I think what we need to do is we need to do the math for people. Because in the end, everything seems like it doesn't touch you until you start doing the math. And I think that's where you begin to see what the contribution means to your community, about why this hospital means to people who actually have healthcare. I mean, I would be basically talking in every Rotary and every Chamber of Commerce, whether it's in a small town or a big town, and I would start doing the math for people. Because in the end, this is so crucial. Yes, we have an older population that needs nursing homes. So now we have to make sure that we continue to have those nursing homes, because we don't have a long-term care solution. Medicaid is our long-term care solution. So if we know that people are going to age, how do we take care of them? But more importantly, we need workers. So we have to expect these workers to be able to stay in the workplace and not care for their elderly people. In addition to which, Jime, I think the most important thing is to do the math and say, but if they're no longer qualified for the expansion of Medicare or Medicaid, and they no longer maybe can qualify for Medicaid because of this ridiculous work requirement that has never worked in any state that's tried it, it's cost too much money and never produced results, then what we have to start asking is, so if they are not covered, then guess what? How do they pay the rent if someone is sick in their house? How do they stay on the job if they can't go to a doctor? How do they postpone an illness because they're afraid, because they know they can't afford to go to the doctor because they're no longer covered by my Medicaid? So these have ripple effects, not just within the healthcare stream, but if I'm a renter or I'm a landlord, I'm terrified. If I own a grocery store or I expect you to pay your electric bill, I am terrified, because this money is fungible, everyone. And if the money disappears here, it's going to have to come out of some other line item. And those line items are about rent. Those line items are about gas and heat and food. And so when you begin to see this, you suddenly realize that those 60,000 people that were covered was one of the best economic infusions in the stability of the North Country and the state. And when you suddenly pull that out, we will all feel it. And this is not a time to feel it. This is a time to say, we're the fourth richest state. How do we stabilize that?
Yeah, and I would agree about, and I struggle sometimes to think about, showing the math, connecting the dots. And I'm old enough to remember Bill on Capitol Hill, and that was part of my civics education in Conjunction Junction. Those are two important things of helping people understand how the process works, follow the people, follow the money, and how do we help people understand that each of us are each other's other, that it won't affect me, it'll affect other people. And well, all of us are the other. So I see ACHS is the People's Health Center. My board is patient majority. I'm their one employee. I'm a steward of their health center. It's not my health center. And Arnie, if your house were on fire, you would take certain actions. Well, our house is on fire, and I have 8,000 patients, and they need to pick up their buckets, and we need a bucket brigade to make sure that this house doesn't burn down. And it's not just my house, but we kind of have the neighborhood on fire. And so I tell people you need to be polite and professional and persistent, and you need to do it now, because having lived in an area to watch two hospitals close, they do not come back. I can promise you that. And even if you could, you couldn't afford to bring them back at today's building costs. And once the employees are in the wind, trying to get the employees back, it's very hard to get back from that tipping point. So I think that's my final words is people take a deep breath, learn to connect the dots, reach out and learn, educate yourself, and let the people you elected who are supposed to represent all of us, especially in the health and wellness, it's 20% of the gross domestic product is health and wellness. So if I can't appeal to your sense of humanity, then let me appeal to your pocketbook or both. I need 8,000 people to come with me. I can only carry 2 buckets.
So let me just say one other thing too, Ed, and that this is something that's more subtle, but nobody talks about. And this is about mental health stability.
Yeah.
How frightened you are when you don't have health care. How frightened you are for your children when you don't have access to health care. How frightened you are to keep your job, I've lost my health insurance 3 times, John, over the course of my lifetime. Do you know why I got political in 1984? Because I had my first baby born without health insurance. And I was working 3 part-time jobs, but there was no Medicaid enhancement. I earned too much to get Medicaid, but nobody would provide me with health insurance because it was a 20-hour job, a 20-hour job, and a 10-hour job. So therefore, I wasn't on their group plans. So I had my baby born without health insurance. And what you will love about this story, you mentioned that there's no more baby deliveries at Cottage Hospital. Guess where I delivered both my babies? At Cottage Hospital. And here's a story that I want you to hold on to. My first baby was born without health insurance. My second baby was born with health insurance. And when I came running into Cottage Hospital, I heard someone yelling up and down the hallway, "She has health insurance. She has health insurance." So I'm an old woman. And this is a true story today too. I don't want to go back to Arnie has health insurance, to know that those 60,000 people that deserve it, that invest in their community, that stabilize a community, they shouldn't lose something that is so not only essential for them, but essential for all of us, John.
I don't think I could say it better, and I want to thank you both. I mean, this not only shows us where we've been, where we are, we've talked a little bit where we're going. It's hard to look back at something um, like Medicaid that has done so much for Americans and lifted so many people, not simply out of illness, but out of hopelessness. And to take away that hope seems incredibly short-sighted and seems incredibly cruel. One thing I was thinking as you were talking earlier, Arnie, is you talk about how life expectancy has increased since 1965. The sad truth is, if we look at the last 5 years, even before COVID, the average expectancy for an American was decreasing. And that's not a good sign. I'm sorry, Ed, you just had your hand up. Did you want to add something there?
No, I was like, yeah, it's starting to tip the other direction. And
Yeah.
infant and maternal health, the mortality is starting to go up, and that's not good either.
It's not a
And
sign
that,
of
and that's all, and also COVID was 1 million people died. I mean, we forget
more
how
than a million,
many,
actually. Yeah.
more than 1 million. So we keep forgetting that number, which is huge, more than almost any other country in the world, despite the fact that we spend
20%.
more on healthcare than any other country in the world. So we have the capacity. We know what to do. The reason I started in 1965 was to show you that it worked. So why run away from something that is a proven track record? You expand on that. You don't gut it.
I couldn't agree more. And I want to thank you both for being here. I'm always reminded by friends and colleagues what an exceptional country America is, and we should do an exceptional job with our healthcare system. This is it's not a good investment. It's a very bad one that will hurt us, one that will haunt us. And I'm sorry to end the 60-year discussion of Medicaid in America on that sad note, but I think it's important that people look to their neighbors and look to their communities and speak up and speak out about what's good for all of us, not just some of us, all of us. Ed and Arnie, thank you for being here today. I look forward to having more conversations down the road. And on behalf of Protect Our Care New Hampshire, I'm Jaime Simoes. Thank you too for Rachel for helping out behind the scenes. Hope to talk more about this soon. This is a topic that we want to continue discussing. So thank you all.
Thank you.
Thank you.
Happy birthday.